The COVID-19 has created a global emergency. Not only has it led to a massive global crisis, but at the same time, the outbreak has created a situation where we all are kind of surrounded by a massive explosion of misinformation and disinformation. People have been misled by unscientific claims, by conspiracy theories, by bad medicinal advices across the world. We have seen people getting hurt, we have seen people taking wrong advices, and we have seen consequences of the actions they have taken on the basis of that misinformation. So the whole question is, why has the misinformation related to COVID-19 spread so much globally? I think one thing was quite clear, that there's a huge population which is online, which is sharing information in a real time. And then we also saw where there was a huge vacuum about accurate information. The misinformation quickly actually replaced the information ecosystem. And that actually created a situation where people absolutely have no idea what was happening in China when the outbreak started. That was the first trend which we monitored, essentially, that when there was no information, the misinformation was replacing the situation. And that is the situation. It was early January when things started becoming clear that there's something wrong happening in Wuhan. But we had no idea, we have no figures, we have no information. In fact, when we saw things going wrong in China, it was only after a Dr. Li came forward through his WeChat post, which essentially said there's something, a disease happening, which is called a mysterious disease happening, which has infected people. And that was January 23, when he actually shared that information through a WeChat. But he was immediately arrested, he was interrogated, and he was asked to sign a paper not to disclose any data or any information related to COVID-19. Soon, however, thousands of residents in Wuhan had contracted the virus that has now spread around the world, claiming over 1 million lives. At DataLEADS, our team has been monitoring the misinformation and disinformation related to coronavirus since January, I think from 15th or 20th of January last year. I think we were one of the first organizations to have a correspondent who is a Chinese national based in Germany, who helped us to understand what was happening in Wuhan in those early days of outbreak. One thing was very clear, which our team was able to understand, was that there were a lot of unrelated content, social media posts, videos, photos, which were uploaded from different parts of the world and which were shared widely and which were shared in a way which misled people essentially about the disease, about the outbreak. During the COVID-19, in the last 10 months, we have seen a couple of key trends related to the misinformation, particularly about COVID and larger issues of public health as well. Some of them was essentially, if we put a spotlight on those issues, was essentially the lack of information, and you can say lack of data in the first couple of months of the outbreak. That was the information vacuum which was created, or which was allowed to be created by the misinformation, circulated widely. Our monitoring work looked at the different kinds of data which was released by different governments and organizations. The early data from China was incomplete and to some extent misleading, that it got viral, but people had no idea what was happening inside China. What we saw because of that, which was, you can say, another major trend, was immediately we saw more conspiracy theories, more claims coming out, essentially saying that the virus was created in a lab as a bioweapon program. Or there was a claim that a couple of people within China were designing a program which was supposed to be a surveillance system, and something went wrong there, and that became like a reason that the virus spread to the rest of the world. There were conspiracy theories that the secret service agencies of America or other countries were responsible of creating this virus, and it went out of control. There is not a good origin story of the virus. I think that's the crux. There was not a good story about how did this outbreak started, and that vacuum in the information ecosystem became one of the first reasons why misinformation actually became quite viral and widespread, because there was not accurate information available to us. We also saw that the misinformation also hit quite hard the food industry in the early phases of the COVID-19. Like, for example, in India, the poultry industry was one of the hardest hit industry because of the rumors circulated that the Chinese food in chicken is responsible for the outbreak of this disease, for the outbreak of this virus. The poultry industry, which in India alone employs more than 5 million people and indirectly some 25 million people and farmers, their business was almost really crushed, as bad as it could have been for them, that they were absolutely left with no jobs and no buyers for their poultry farms actually. So that created a situation where the farmers became quite victims of this misinformation in the early phases. Then we saw in different countries, and again the worst in India, the migrant crisis, which started by a decision which was taken by the government in a rush, in a sudden announcement, when it was announced that the whole country will go under lockdown. Millions of people, millions of migrant laborers decided to leave for their own villages and homes. And they started a journey with no idea why to take a bus, why to take a train, and how to reach their families. They had phones with them, and that was their communication with the rest of the world. And those phones eventually became a source of lot of misinformation for them through WhatsApp or through other forms. And some of them rush to the railway stations without knowing whether there's a train for to their hometown or not. Some of them rush to the bus stations without knowing whether there's really any bus which can take them back to their village. So that created a very distressing situation, and it was unimaginable suffering and chaos, where we saw millions of people with their families and with their kids walking on the national highways hundreds of kilometers trying to reach out their family. That situation became worse because there was so much misinformation about basic things, how they can protect themselves and how they can go back to their families, because there was no arrangement to have a single communication with about the lockdown. And I think those stories were also replicated and also was seen in other countries as well, where people were really stuck because the governments were not really clear how to communicate with the people what's happening and what should they do about it and how should they be safe about from the COVID-19. We also saw a situation where discrimination and stigma was faced by the doctors. There have been a number of attacks on healthcare professionals, on doctors, because of the fear of COVID-19, because many doctors and nurses were assaulted, or they were harassed by the people, or in their neighborhood by their communities, because there was a fear that these doctors may infect other people in their communities, in their neighborhoods, because they are in close touch with the COVID-19 patients. So imagine a situation again where healthcare professionals who are at the forefront of fighting this disease and saving people became the victims of the misinformation. We have seen the healthcare campaigns or information campaigns in many areas, in India essentially, in Pakistan, in Bangladesh, where they were stopped by the people from going door to door and informing people about some basic measures they can take to protect themselves from the COVID-19, because people were fearful that the doctors, because they're treating COVID patients, they may infect other people. I think that was also a very tough situation for healthcare campaigns to ensure that people understand that how they can be protected during this tough situation. We also saw a situation where we saw a lot of misinformation about cures, unsafe cures and treatments, going viral on different platforms. Like, for example, a lot of viral information was available on social media, like homeopathic preventions from coronavirus, like keeping the throat moist consistently, or notifying people not to buy colors from China because of there's an outbreak in China and that may infect people who use those colors for different festivals. We also saw one of the earlier trends, which was essentially about how world leaders, politicians, and celebrities became the source of misinformation. We have seen in many countries the political leadership was not really clear how to engage the people in order to understand, let them understand that what the challenge is and how they're going to be safe from it. We have seen the whole discussion about whether the mask is necessary or not, and we have seen world leaders in some countries, essentially in particular, they were miscommunicating with the people whether the mask is necessary or not, and that led to a situation where the millions of people in those countries eventually ended up having no mask at all. And we have seen also big celebrities, the film stars, the lot of other people as well, who misled people by their tweets and by their social media posts about the treatments, the local treatments to the COVID-19. Well, there was no treatment at all for COVID-19, like as worse as like a politician in India essentially suggesting that the cow urine or a cow dung cake can be a cure for COVID-19, and that millions of people actually follow that politician on social media. So imagine a situation for a person who has no idea what the COVID is, who lives in a village, and then he believes the politician who is actually going ahead and telling him that no, if you do this much of thing, you will be protected or not. And but then there was no science behind that. There was another thing and another major narrative we have been watching very closely around COVID-19, which is stereotyping minorities. We have seen false claims and baseless accusation that certain communities were spreading the virus, whether intentionally or not. In particular, there was an uptick in Islamophobia and racism in COVID mis and disinformation online as internet users pointed fingers at specific communities. Videos showing Muslims' prayers on streets went viral in China, claiming that the Chinese are converting to Islam and starting praying after COVID outbreak. These all narratives actually essentially resulted in a situation where these sections of communities and where people of particular religion or sects were accused of spreading COVID-19. And that led to attacks on these communities, that led to attacks on the religious places of these communities, that led to attacks on the businesses of these communities. I think that trend became quite escalated actually in the last 2, 3, 4 months. We have seen certain increase of hate speech essentially created by the misinformation related to COVID about these communities. So eventually what we are seeing right now after the 10 months of the COVID-19 is that an avalanche of misinformation and disinformation originating from different parts of the world, but online essentially, where people are saying and sharing one thing which is wrong and harmful information from one part of the world, and instantly, because of the nature of internet and because of the nature of social media, the same thing reaches thousands of kilometers away instantly, and people upload that content in a different format, in a different context, and they circulate it. Some of it is happening, you can say, as a misinformation. People just do not know whether this is true or not. But we have also seen, which was a major trend during COVID-19, because there were certain characters which were deliberately spreading the misinformation for different reasons. Whether those reasons were their own biases, whether their reasons were their own national identities, or whether those reasons were their own dislike for science or dislike for medicine. But we are seeing a global world is engulfed in misinformation related to COVID-19. Right now, where we're still in the fight against the COVID-19, it's an uphill task to combat the misinformation. And the biggest challenge of the misinformation is that it's not that people believe misinformation, they believe disinformation, they believe rumors. The bigger issue and the bigger problem is that the whole ecosystem of misinformation eventually leads to people to a situation where they don't even believe the truthful information. And that is a serious challenge, because that eventually is going to harm any effort to deal with with consequences of the COVID-19. Because we are right now in the middle of vaccination drive. We're searching for the right vaccines for the disease. And there are already hundreds and thousands of posts, videos and audio clips and the photographs, which essentially have put a shadow of conspiracy over the vaccination initiatives and the people and organizations who are involved in the search of a right vaccine to treat COVID-19 disease and to protect people from the disease. So I think that is this misinformation is creating a situation here where we have to really find a larger global collaboration and understanding, where understanding how to deal with the changing information landscape, how to deal with the misinformation at a level where we are having a global understanding that each one has to play his role in this major global initiative to identify and combat misinformation, to combat COVID-related misinformation. I think the challenge will remain for all of us in next 1 year to understand these different narratives and trends and try to learn key lessons from them so that we come back more stronger, we come back more clearer, we come back more armed to deal with this crisis. Because one thing is quite clear, that we have reached a stage in the world where we will have more information for sure. People will have more information for sure. And how will we help them to distinguish truthful information from the false information? I think that is the challenge for the world leadership. That is the challenge for public health community. That is the challenge for a media as well. I think all of us need to come together and to identify a strategy globally, a long-term investment into our educational system for that matter, a media literacy system for that matter, where we are able to shape a new discourse about health information, health communication. And that is why we're here at this summit, at the summit of misinformation in medicine, collaborating with doctors, technologists, fact checkers, policymakers, and bringing them on board, trying to build a new dialogue about how we deal with the challenges of information, the challenges of changes in the landscape of information, and the challenges of working and building collaboration. Because collaboration needs investment, collaboration needs effort, collaboration needs a vision. And if we don't share the same vision and understanding, we will not be able to deal with the challenge of misinformation. And I think this is a one challenge which is a long-term one. It's not going to end in next 1 year or even with the COVID. This challenge will remain there because humans, for the first time in their history, are creating more information than they are able to consume.